Dr. Harsha. I'm a consulting diabetologist practicing at South Bombay, Worli, and Andheri. First of all, I'd like to say hi to everyone and hope everyone is fine. And I'm happy that everyone to have a protection value over the period of time. So today's main agenda for meeting you people up was to discuss a few things around which I can provide it from myself being a medical practitioner as to provide them with steps for following in order to have a good control for not only diabetes but also for preventing as a precautionary guidelines for prevention for the COVID-19 epidemic which has been happening around the world. So first of all, as we all know that the COVID-19 has been spreading all over the world and specifically in Mumbai where we have been staying, the things are just not looking that great. And if you look at the total probability of the patients who are getting infected, there has been a lot of patients who are infected with which are having comorbidities like diabetes, hypertension, and other issues like cardiac issues. So my main aim is to provide them with details or precautionary guidelines at least which can be taken care of in order to have a safety part in this pandemic era. So regarding the precautionary guidelines, what I can say the general part as a government and everyone has been pledging it to everyone is saying stay home, stay safe is something that is the agenda or the tagline that we have been using it for most of our patients. Second part which we usually tell our patients is social distancing, which is very much important. Unless and until it is not required, please bear in mind of not moving out of your houses. You might be having a lot of children or you might be having senior citizens in your house. So at least you need to be very cautious in preventing going out. And in case if you have to go out for buying some of the other issues, make sure that you utilize all the safety precautions like using a mask, avoiding contact, social distancing and everything. And once you are back, try to use a sanitation part, just to use the sanitizer and also try to sanitize the things that you have got it from outside as well. So this will be something which is very important. The other part is washing your hands for at least 20 seconds with any of the soaps or antiseptics is something which is very important which we need to keep in mind. Apart from that, in the diabetic part, we know that most of the diabetic patients, we know the diabetic population is very high in India, especially in Mumbai, and we have been treating a lot of our patients. But the most important agenda that you need to keep in mind while getting yourself treated is first thing, you do not have to get panicked listening that the comorbid patients are at a very higher risk. Yes, they are at a very higher risk, but if a total care has been taken off, the total guidelines has been taken care of, they don't need to be worried about. Regarding diabetic part, what we can say as a patient is you have to stay calm. You cannot panic because by chance, because of stress and anxiety, the sugars might go up and it can have detrimental results over the future as well. Second part is the patient has to take the medications properly. The patient has to continue with all the medications as guided to them. In case if they have any issues, they should talk to their respective medical professionals rather than themselves deciding at what needs to be done, what needs not to be done. Apart from that, self-monitoring of blood glucose is also a very important aspect which we need to keep in mind during this particular part. The sugar level has to be maintained between 100 and 160. That is something that we usually tell for most of our patients around. We don't want to be very aggressive. We don't want to be very lenient, but 100 to 160 is something that the target that we usually tell our patients to go ahead in such kind of a conditions. Third thing is you need to have your regular meals that we had decided earlier as well. Small frequent meals, I know it's going to be very difficult at this point of time with no housemaids and everyone and every family member is getting involved in some of the other activities to help the house out. So in that particular part, what we need to do, we need to have healthy food, house food, that is something which we need to take, but the food which is of less glycemic index or we can say of low carbs or something like that so that we can prevent the spurts of sugars that happens while taking it. Apart from that, try to avoid the aerated drinks, the colas and everything which might hurt you in the future as well. exercise is something which is very important at this point of time. Now at this point of time, you cannot be laxing. You don't want to make yourself body very lethargic kind of a thing. So you need to exercise as in the form of you can say stretching, or at least a walk in your house. At least 30 minutes can work really good for you. Apart from that, if you can have breathing exercises, yoga, these are the few things which will help you in calming your bodies. You will feel much better. A positive vibe will start coming out of it. So I think so that also works really nice for most of the diabetic patients. Apart from them, what I suggest is sleeping is very important. Your body requires at least 6 to 9 hours of sleep every day. I think so in day to day very difficult, where most of the patients find it difficult for having a sound sleep. So this is the time in which you can have a 6 to 8 hours sleep, which can work really good for you. Apart from that, decreasing your screening time. I know very much that most of us are very excited and having a look at the news, what is happening around in the world and everything. But my only advice is try to decrease down your screening time for the news, for the movies, or whatever entertainment part that you have been doing it. Try to go for more of physical activities that the patients will be benefited for. So that will be something which will be there. Staying positive, staying a very quality time with your family is something which is very important at this point of time. I'm sure that none of us have ever thought that some days like this will happen over a period of time as well. But now that the things are there, the best thing that can be done from our side in order to help our country, help our world from coming out of this pandemic crisis is staying at home, staying positivity, and more importantly, spending some quality time with our family in order to protect not only ourselves from them and others and them as well from any other outside contact for a coronavirus. So my last message is stay safe, stay home, stay healthy, and that is the most important tagline that we need to carry on for at least 3rd of May, maybe post that also. If it might increase, we have to stay positive and try to follow this precautionary guidelines as well as the diabetic guidelines which I've suggested you, which might help you in the future as well. So stay healthy and stay safe. Jai Hind, Jai Maharashtra.